There could also be a thrombosis of the inferior vena cava. There could also be a thrombosis of the inferior vena cava. And looking at the anatomy, just to remind you guys that this is actually the inferior vena cava, all right? Now, there could be a thrombus. What is a thrombosis? A thrombosis is when there is a thrombus formation. There is a thrombus formation right there in the blood vessel. And this thrombus formation is kind of like trying to block the blood vessel halfway, or there could even be a total blockage of the blood vessel, all right? So here we're just trying to now discuss if there's, can you see how big this IVC is? These ones are different problems of the inferior vena cava, but we're actually focusing on this one, which is there's a thrombus that is formed in the inferior vena cava. So we are now saying if there's inferior vena cava thrombosis, how will it present like? Okay, what are the symptoms? How can we be able to diagnose? How can we be able to treat a thrombus? Okay, because treatment of a thrombus is actually the same thing, okay, with all other vessels that we have discussed. So let's talk about the IVC on. So this inferior vena cava thrombosis is a blood clot formation in the inferior vena cava. And inferior vena cava is now the major vein that carries what deoxygenated blood from the lower parts of the body to the heart. All right. So the types could be that this inferior vena cava thrombosis is acute. It could be that it is chronic. It could be that it is partial, where there's just partial blockage, or it could be that there's complete blockage. Okay. So here now, what are the causes? What could make blood actually what clot in the inferior vena cava? It could be because the patient has some hypercoagulability or disorders, which we have already discussed, all the hypercoagulability disorders. It could be because of cancer. It could be because of trauma. It could be because of what infections. It could be because of central vein catheters that the patient is currently on. It could be because of pregnancy. It could be because of what? Oral contraceptives. Okay. The symptoms, yeah. If there's inferior vena cava thrombosis, it could lead to things like swelling in the legs and feet. There'll be pain and tenderness in the legs. Skin discoloration, right? The patient will be cyanosed. There will be shortness of breath. There will be chest pain, right? Diagnosis, you might want to use things like what? Ultrasound, CT scan, MRI, venography, um, blood test, then some physical examination of the patient, right? Treatment, you give anticoagulation therapy. Okay, anticoagulation drugs, these are drugs that are against coagulation, right? They give drugs that will basically break down the thrombus. That's what thrombolysis. Then inferior vena cava what filter placement. The surgical thrombectomy, where you are surgically trying to what break down the clot, right? The compression stockings too can also help. Complications, this can lead to things like what? Pulmonary embolism, post-thrombotic syndrome, chronic venous insufficiency, renal failure, and severe bleeding. Okay, so that's just it on the concept of inferior vena cava thrombosis.